Caroline, what do men who participate in ReIMAGINE screening need to know?
Men will have been identified by their GP practice as being suitable for invitation, and they'll receive a letter offering participation in ReIMAGINE screening. If they're interested and want to take part, then they'll contact the research team. An appointment will be made for a blood test and an MRI scan. So first of all, we want to find men who don't already have a diagnosis of prostate cancer. Men will be selected based on their age, and men between the ages of 50 and 70 will be invited. Prostate cancer is a common cancer in men, and it's the second commonest cause of cancer-related death in men in the UK. The tests that we have to look for it have traditionally been a blood test and a standard biopsy, but now we have MRI scanning, which is much better at picking up the important cancers. The ReIMAGINE screening study will use MRI as the first test to assess men, and this will help us to determine whether MRI as a screening programme might be feasible in the future. We hope that if we could find the building blocks of an accurate screening programme, then we could reduce the number of men who die of prostate cancer in the UK.
Will men who participate in ReIMAGINE screening need to have a digital rectal exam as part of the process?
No, they won't. We know that the finger in the back passage test, where a doctor or a nurse feels the prostate from inside the back passage, is not as accurate as it could be, and that the MRI scan is much more accurate than that. So we're not using that as part of the ReIMAGINE screening study.
Are there any reasons men couldn't participate in ReIMAGINE?
Yes, so if a man is not able to have an MRI, then he wouldn't be able to take part. Some people aren't able to have an MRI scan because they've got an implanted device such as a defibrillator or a brain stimulator. It would be dangerous for those men to have an MRI, so they won't be able to take part.
How will men find out the results of the MRI and blood tests?
So they'll get a letter from the ReIMAGINE screening programme saying whether they've tested positive or tested negative, and then it'll be explained if they need to do anything further.
Does that mean that some men who participate with ReIMAGINE screening will be diagnosed with prostate cancer?
That's possible, but it won't be directly in the ReIMAGINE screening study. Men will be invited for their blood test and their MRI. If those show that they screen positive, that will mean they're at risk of prostate cancer, and then they'll go through the normal NHS route to receive any further diagnostic tests.